Joshua?
Okay, I think we should be live now. Okay, so thank you both Chris and Samiya for joining us today for our part 3 in our anti-hate series. Today, as you know, we'll be focusing a little bit on anti-Black racism in the healthcare system and how that's playing out in during COVID-19. So my name is Samiya Hassan, and I'm the Executive Director of the Council of Agencies Serving South Asians. Before we begin, I'd just like to do a land acknowledgement. The work of the Council of Agencies Serving South Asians takes place on traditional Indigenous territories of the Huron-Wendat, Haudenosaunee, and the territory of the Mississaugas of the New Credit. This territory is part of the Dish with One Spoon Treaty, an agreement between the Anishinaabe, the Haudenosaunee, and the Allied Nations to peaceably share and care for the resources around the Great Lakes. This territory is also covered by the Upper Canada Treaties. Today, Takaranto, the traditional Mohawk name of this area called Toronto, meaning a gathering place, and its surrounding areas are still home to Indigenous people, and we are grateful to have the opportunity to meet, work, and play on this territory as settlers. So for today's session, like I said, we have Dr. Christopher Morgan from the Black Health Alliance, and we have Samiya Abdi, who is a senior program specialist with the Ontario Public Health Agency. So just a little bit about each of the speakers today before we start our conversation. Again, these are going to be very short bios. Both of them are very accomplished individuals, and I can't do justice to their entire experience and their background. So I'm just going to give a bit of a bio, and the rest will post on the Facebook Live comment section after we're done the session. So Dr. Christopher Morgan, in 2000, Dr. Christopher Morgan spearheaded the formation of the Black Health Alliance, a charitable community-based network of organizations and individuals working in partnership to advance the health and well-being of the Black community. The BHA's mission is to reduce racial disparities in health outcomes and promote health and well-being for people from the diverse Black communities in Canada, with emphasis on the broader determinants of health, including racism. Samiya is a consultant, public speaker, and a community animator who strategically fosters collaborations, connections, and consensus to shift the public health system to be more equitable. Samiya's philosophy is grounded in challenging multiple intersecting forms of oppression, understanding marginalization in knowledge production, research, and practice, and building equitable relationships. She is passionate about creating safe, non-judgmental spaces that foster growth, allow for failure, and transformational learning. Thank you again to both of you for joining us today. And just a bit of background, this series, if you're tuning in for the first time, this series is part of CASA's ongoing anti-hate work, which is in collaboration with our anti-hate community leaders group. These sessions take place every Tuesday at 4 o'clock. And they're available for viewing on CASA's Facebook Live page, and we also upload it on our YouTube channel once these sessions finish. So let's get right into it. Samiya and Dr. Chris, thank you for joining us on this important discussion on anti-Black racism in our healthcare system and how that is playing out during COVID-19. So recently I've been reading a lot about, during the pandemic, about the disproportionate impact that COVID-19 has had on racialized communities, so namely Black communities, South Asian communities, Indigenous communities. What are you both seeing in your respective organizations in this respect? What are some of the inequities that you've been seeing and you've been hearing about and witnessing in terms of what the Black community is facing as a result of COVID-19?
I can go ahead first.
Sure.
Hi, Samiya. Hi, Christopher. Thank you so much for having us here. And just right before I get into this really important topic around anti-Black racism, I just want to share with you quickly something that's heavy on my heart today. Just remembering the brutal murder of Ahmadou al-Bari a few weeks ago, and then the story that came out regarding Christopher Cooper barely escaping with his life because of weaponized white fragility. And then finally, this morning, witnessing the killing of George Floyd and taking his last breath because of police brutality. Um, it just makes us to realize that anti-Black racism is well and alive, pandemic or non-pandemic. COVID-19 did not equalize the response. And even though there was a lot of conversation about how this illness, this pandemic is affecting everybody, but the reality is it's not affecting everybody equally. So as we move in from, the killing, the hunting down of Black men, particularly, and Black women and Black children, and even though we might think that's far removed from us, we have our own cases here in Canada and in Ontario in terms of the disproportionate targeting of the police around, whether it's the laws around social distancing. And we all know as a Black and Brown communities that if what has happened in over the past weekend in downtown Toronto, if the faces that those pictures and videos were full of Black and Brown people, the response would have been very different than our mayor, which I respect, going down and having a conversation with those who were breaking the rules. So the outcome would be very different. So as we are starting with this conversation, we have to ground it in the bigger picture of, yes, this COVID-19 is impacting our community disproportionately, but also our lives is being impacted with how we are policed, with our systems of education, with our system, the healthcare systems, and the broader systems that are all in play. So I just wanted us to kind of ground us in these realities and just kind of share with you where I'm coming from with a heavy heart today, trying not to really watch any of the videos or the pictures, but also remembering that's the reality and that we don't have the privilege of tuning out and forgetting these are our reality, that our brothers that are being killed on the streets. So with that long introduction, so those of us who are working in health equity knew that the moment that this hit, that it will be disproportionately affecting our communities. And the reason is because we have evidence from actually the last pandemic, from H1N1, that it has disproportionately affected the Black community, especially in Ontario. And we have data to show that Black community was 10 times more likely to be infected than the broader communities. Also, we've seen the numbers come from both the US and the UK, with things like 33% of hospitalization of COVID were amongst the Black community, while only 19%, they make only 18% of the US population. And we also know that it's not only exposure and infection rates, but also adverse outcomes. So we're also seeing Black patients suffering more severely, like having more severe outcomes, as well as higher death rates amongst the people who are dying because of COVID-19. So, for example, in Michigan, 40% of the death are amongst the Black community, while only 14% of the population in that state are Black. So, and now we don't have the numbers in Ontario, but there has been some preliminary work done using Ontario marginalization work by ICS, as well as how to house my flattening project, as well as Public Health Ontario is doing some work around this. So using that data that's neighborhood based, we are seeing that racialized communities, neighborhoods that have higher racialized populations are also having higher infection rates, as well as higher death rates of COVID. So this is just to start us off in terms of how the Black community is doing without us even having the correct data or the numbers. But from what we know from the past, from what we know from how we're experiencing the healthcare systems in general, and then extrapolating some of this information through other sources such as Ontario Marginalization Index.
Thank you very much. I agree with you 100%, Samiya. Thank you for that introduction. The COVID-19 situation has really been a case where many have described it as a crisis within a crisis, is that the situation was already troubling and alarming for the Black community. We know that we're 3.5 times more likely to be at risk of food insecurity. This is prior to COVID, and now with the COVID situation, the needs have only escalated and become worse. We represent about 7.5% of the population in Toronto, but yet make up about well over 13% of those residents living in low-income neighborhoods and so forth. So the complications and the compounding of poverty becomes worse. You know, when we witness and hear about the trauma, the victimization of fellow members of our community, the mental health impacts are long-lasting and severe. And then you combine that, you know, the uncertainty about the future, about loss of income, about the safety of your children, kids trying to manage, you know, with the online learning. And I know families whereby that's just not a possibility. The reality of having the access or the tools to provide that for their children is challenging, not to mention families who have children with, let's say, learning difficulties or autism or disabilities. So the COVID has only served to amplify or throw fuel onto already a fire. And it's on all levels, on service delivery, on the ground, and whether that's in housing, policing, you know, healthcare, it's right across the board, across many sectors. So the inequities and the burden that Black people are having to endure during this time is unprecedented, and which means that the response has to be more fervent, more coordinated, and the advocacy has to step up. And of course, we need to look at changes that are not only going to come to address immediate, on the ground, today needs, but also looking long-term, generational.
I realized I was on mute. So both of you mentioned that we have data from the States, and we have some data from the previous pandemic, the H1N1. And there's been quite a bit of advocacy and talk recently about the collection of race-based disaggregated data. Can you tell us a little bit about why it's important to collect race-based disaggregated data, not just for this pandemic? Obviously, it's very important for these kind of situations to have the data so we can plan and have proper strategies in place to address them and to resolve them. But why is it on an ongoing basis, or especially for racialized communities, to have a system in place to collect this data?
Okay, I will start. Data is critical. It is data leads from research. Good research leads to good data, which is going to inform decision makers and policies, and hopefully end up in changes in terms of systems and service delivery on the ground. Not collecting the information weakens our position and weakens our capacity to make the right decisions around where investment needs to be, what communities or groups or populations are falling through the gaps, and also to be able to track improvement or change over time. Weeks ago, I'm sure we've all heard when you know, the chief medical officer of Ontario basically, you know, was questioned about whether or not the need to have disaggregated data looking at race specifically, and essentially he said that this wasn't a priority, it wasn't identified as a priority. for many of us, we know that this is not acceptable. As Samiya had mentioned earlier, when we went through a pandemic before, we have evidence that there's a disproportionate effect or outcomes among populations. If you don't track the data, if you don't measure, it's hard to provide evidence. We live in an evidence-based society now. All decisions are based on evidence, and numbers gives you the speaking points, gives you the arguments for what needs to be done and where it needs to be done. So the data piece has been huge. It's something that the Black Health Alliance has been advocating for a long time. And even recently during COVID, a number of health organizations and leaders within the community have been pushing for the data. And I think probably most of us know that the City of Toronto has recently acknowledged that they're going to be taking data as it relates to COVID that includes race and ethnicity and some socio-economic information. The province, in response to a lot of the pressure that was put on them, has also acknowledged that this is something that they're going to start doing as well too. The exact details, we want to see it obviously extend beyond just for the COVID situation, because this is something which is critical. It's critical to, if we want to real change and be able to track and monitor our progress, and it speaks to accountability, then the data is absolutely necessary.
Yeah, so I agree with Dr. Morgan, absolutely. And what I want to add is that it actually removes the deniability of the reality of disproportionate impact. So we are, when we have the numbers, communities are able to demand better care and access. And also this whole idea of evidence, which is, we know that anecdotal evidence or storytelling, which is valid way of also counting. However, the colonial system does not necessarily account for it or see it as valid method. So the stories that we all know and we've been telling ourselves, and the realities that the communities have been experiencing for years, when we have actually systemic way of collecting data, then this brings it to the forefront, and we actually have the proof to be able to, as Dr. Morgan said, to change. Then public health organizations can change the way they do their programming, their services, policies can be tailored to support communities who are disproportionately impacted, and to also hopefully reverse or change those inequitable outcomes. The two things that I just wanted to also mention is that sometimes data is a double-edged sword, and that historically it has been used as a tool to stereotype and harm Black and Indigenous communities. And even right now, there's conversation that is happening that, you hear things like Black community members are dying disproportionately from COVID-19, but without putting in perspective the why and what system has allowed this to happen. So we cannot make the identity of Blackness or race, so when we say even race-based data collection, we cannot talk about race without racism. We cannot talk about race data collection without thinking about how this data is going to be analyzed, who is going to analyze it, what metrics are they going to use, and how is it going to be interpreted, and more importantly, how is it going to impact decision at the decision-making table. And with that, just to maybe some of the conversations that I've heard members of the Black community and Black leadership having are the idea of applying the OCAP principle, which is really an Indigenous principles of ownership, control, and access and possession over data. So the data does not become a tool that is used to harm community, but a tool to be used to benefit and to bring equitable systems into effect.
So both of you mentioned about some of the initiatives that certain levels of governments have announced, like John Tory had announced that they would start collecting race-based data. And then BHA is doing quite a bit of advocacy work around policy changes. What kind of response and reactions are we seeing from the bureaucracy and decision makers and policy makers? Are we seeing a fast enough response, or are we seeing more barriers, and lack of leadership. What's your experience been like?
I think the leadership has been, or the response has been, the onus has been on our community to really push the agenda and push and push and push and push the agenda. The response from different levels of government, I would say at the city level has been more responsive to the idea about looking at. I mean, they've established a confronting anti-Black racism unit, which has been very supportive of the Black community and Black organizations and so forth. And so they've been more responsive to the issues being brought forward from the Black community, whether it be around looking towards culturally appropriate programming, collecting race-based data, and so forth. Certainly at the provincial level, again, I referred to a couple weeks ago, the highest member medical officer, this was something that just wasn't on the radar. And it's something that we've had to really push and push to really get some movement on. And as Samiya had mentioned, part of the discussion is not just doing the data, but absolutely making sure that it's done ethically and responsibly to protect the community that you're serving. So we have to, the work of our organizations is to keep to light the fire on the decision makers, get our issues at the table, to be at the table, to continue to advocate for what needs to be done. And definitely different governments and different, leaders within governments and so forth, their response, it varies. It can vary, and so we have to develop different strategies and approaches to get the outcome that we're looking for.
Yeah, so I was just going to mention, as someone who sits on the other side of that equation, which is not the advocacy side, but the side of providing resources and scientific evidence to policymakers, is that there is a response, and I agree with Dr. Morgan. The response did not come out of thin air. It came because of the Black community leaders pushing for this conversation to happen and for this response to take place. So there is a process in place, and I think Dr. William announced maybe a few days ago that Ontario will be collecting also race-based data, as well as the Ontario Anti-Racism Directorate has been really a great unit to have in place. Unfortunately, health was not one of the areas that they focused on. They focused on policing, education, and other areas. However, because of this, there is a movement on that front as well to include health as Dr. Mengar said, I don't think the community is interested in a COVID response only, that this needs to happen beyond COVID, and this needs to be established and instituted in a way that so we understand what's the impact of racism, anti-Black racism, particularly on communities.
Mm-hmm. And what do you think is the role of individuals, like community members, in this advocacy and in trying to raise awareness and trying to push policymakers to take certain decisions? What do you think is the role of individual community members?
So I would say act from wherever you are. Like that has been always with whatever power you have or non-power, like everybody has a place. And so just know where you can push from. We can't all be activists and we can't all be advocates, but we, even within our roles, whether they're limited or vast, just recognizing that if our core mission is to really live in a just world and to address inequities, then be strategic in how you are acting and support organizations like the Black Health Alliance and others who are at the forefront and willing to kind of risk their whatever it is that they need to risk to push forward.
I would agree. I think, sometimes we underestimate our voice and our power. And I think it's critical for any person, young people, seniors, wherever you find yourself, wherever you're as a student or if you're in the workplace, that if you see something that you feel is wrong, that shouldn't be the way it is, join an organization, write your NDP, send a text or send a message. Have your voice, or find other people that share your view to strengthen it, because the numbers give you some strength as well. So I think as a collective, and this is part of the challenges too, as a community, the Black community is diverse, and there are many different approaches and styles. And Samiya mentioned it too as well too. Some of them, some of us our advocacy role or approaches can be different, and there's room for all of that. The challenge, of course, is just coordinating those voices and collaborating and developing a strategy that's going to be effective. And at the end of the day, that the next generation won't have to, bear some of the burdens and the challenges that we have, just like our forefathers that have, paid with their blood and their lives so that we can have some of the opportunities that we have here. We have to continue that struggle for our children and our children's children. So we all have the power. Our voices are critical, and being willing to work together and keep our eyes on the prize, despite whatever differences that we may have in philosophy and so forth. If the goal is to improve the health and well-being of our community and keep that central, then we should and must and have to be able to agree on some key priorities and keep our focus on that and work together to achieve it.
So we don't have much time, but I do want to ask this question. It's not directly health related, but it does have to do with the social determinants of health. And so throughout this pandemic, we have been seeing, to my personal surprise, an increase in rates of hate-related incidents. So whether it's related to anti-Asian racism, whether it's related to anti-Persian racism or Islamophobia, have you seen an increase in anti-Black racism during this time? I know I was reading an article from the States where it said that Black people get in trouble for wearing a mask and for not wearing a mask, right? So there was an incident of people questioning somebody who was Black because he was wearing a mask and he was shopping in a supermarket, and he was asked to remove the mask. And then when Black people are not wearing a mask, the whole community is demonized for not being compassionate. So are we seeing something similar here in Canada, or particularly here in Ontario?
Do you want to start, and then I'll follow your lead?
I would say that I haven't come across many specific cases like the ones that you described. That's certainly not to say that it's not taking place and it's not out there. I remember a case where I believe it was someone in Montreal or Quebec, and it was a Muslim woman and on a hijab and so forth, and had a face covering. And it was interesting with the laws there that, recently that was considered almost illegal as an act to do, and yet now it's being encouraged. And so it struck me that what was believed that was done for cultural and religious purposes at one time was considered unacceptable, and there's a level of intolerance for that. And then now, it's actually being encouraged, and we want everyone to do it for health reasons, for public health reasons. So in many ways, these are kind of indicators of levels of anti-Black racism and Islamophobia and those kind of things where, under people's beliefs and values and culture and identities are regarded as less than or not acceptable in Canadian society and so forth. And so we need to be vigilant and always be aware of this. I just wanted to share something briefly. Many of you probably have heard the story where there's recently a personal support worker, a Black gentleman in Brampton area who recently passed away due to COVID. And 2 weeks ago, his wife was telling the story on the radio station. I was listening to it, and it was quite disturbing. And one of the key things that really hit home when she was describing his sickness and illness at home, and he was weak and fatigued and fever and chills and so forth. And he did not want to go to the health system. And he told his wife, they're going to kill me in there. And I don't want to go. And he had worked in the system for more than 2.5 decades. And the general fear of going there because of what he didn't feel he'd get the appropriate care right on the ground, you know, and as it turned out, and sadly, she had to take him. And because of COVID-19, she had to basically leave him at the front door, couldn't go in, be with him, couldn't advocate on his behalf, couldn't watch over what was happening. And, you know, as those of you who may know the rest of the story, 2 days later, he passed away. So the effects are on the ground, they're real, they're taking our lives. And we really have, as a community and a society, we have to realize that when any group is being marginalized or suffering and is not given the opportunity to thrive, we all suffer at a collective. So we need to do better.
Yeah, I just wanted to also add, like, there has been recently, so the thing that I mentioned about the over policing Black bodies, for example, I think I saw an article that said over 80% of people who got fined in New York City are Black, as well as knowing that, you know, for example, there was that incident a few weeks ago with a Black father with his sons, just, you know, teaching them to rollerblade in a parking lot, an empty parking lot, yet getting fined $800 or something like that. So, so it's this idea of when Black people are interacting with systemically racist institutions, then naturally they are going to be experiencing anti-Blackness. That they have experienced it prior to COVID-19, but right now there's this heightened sense of protection and you know, disproportionate application of force that actually might be really harmful for the community. And talking about this face covering, I mean, it's a joke, but it's like, I mean, it's sad, but you know, you see on CNN and you see all these people who are wearing bandanas on their mouth and around their mouth and things that would be, you know, viewed as gang paraphernalia, and you know, Black people would actually get really in a lot of trouble for doing. Yet now people are, you know, it's a fashion statement. So it's always it's criminal when it's with within the Black community, and as soon as it moves on to the mainstream, then it becomes a fashion statement, or it becomes something that's normalized and accepted. So I mean, we learn to laugh about it, but these are the realities and the way we accept or live with anti-Black racism in different parts.
Mm-hmm. Yeah, and I was thinking the same when you brought that up, Dr. Morgan, about the face covering and how the public perception changes. And it's no longer considered a security threat. Now it's highly advisable that you cover your face. So it's different how it's interesting how society comes to view these things that really impact certain communities a lot more negatively than others. So thank you once again for joining us today on this session and really enlightening us with your comments and with your wisdom. And I'm hoping that the people that are tuning in and that are looking at this session will find ways to get involved, will find ways to join the advocacy. There's a lot of advocacy going on. BHA is an amazing organization. And Samiya, I know that you do a lot of advocacy as well for with the Somali community. So please get in touch with these amazing leaders and find a way to get involved in the advocacy. So we'll be back next week. Our session next week will focus on the rise of the right-wing movement and white supremacist groups. And we will be featuring certain individuals from the Canadian Anti-Hate Network. So that will be next week, Tuesday at 4 o'clock. Thank you once again for joining us, and hopefully we'll see you again next week.
Thank you.